I just wanted to speak a little bit about my own area of research, and that is trigeminal neuralgia. And you might ask, what is trigeminal neuralgia? Well, most of you know what trigeminal neuralgia is. Basically, it's the disease of the fifth cranial nerve, which is actually, as my research has shown, the giant of the cranial nerves. And when it is in any way traumatized, it really causes patient chaos for the patient for many years. And how does the patient present? And how would you know if you had trigeminal neuralgia? Well, the first thing you would complain about is very, very severe pain to one side of the face. And the pain will just come out of the blue. And usually it will affect the middle and lower third of the face. And it will continually reoccur. And you might think it's a dental, infection, or that you've got a sinus infection, there's something wrong with your middle ear. And you'll be going around from specialist to specialist until somebody literally sort of says, hang on a minute. I think, you've got nerve damage of your face, that it might be the trigeminal nerve. The history is fairly classical. And really, we as physicians, the first thing we should do is that when we hear this history, we really should believe the patient. And that is the first thing. And then the second thing then is to really refer them really pretty promptly to neurologists, neurosurgeons, or pain specialists, because, they really do need urgent treatment, because it is a devastating disease to the patient concerned. And you see, this disease in the past was called the suicide disease, because what happened was that patients, who didn't get the correct treatment or who weren't believed by their physicians resorted to this pathway because there was no other pathways left to them. So it really is incumbent upon us, the physicians, that when we see a patient who has this chronic facial pain on one side of the face, which is not going away, and really, this really does, really sound like trigeminal neuralgia, and we really must act very, very promptly in the patient's interest. That is my message for you today.